Welcome to Alcohol and Other Drugs at Work, What Supervisors Should Know. This program will increase your awareness about alcohol and other drugs of abuse, the effect these substances have on employee productivity and health, and the adverse impact on the well-being of your entire work organization. We will be discussing the signs and symptoms of a substance abuse problem and how signs and symptoms of a drug problem can change from one type of drug to the next. We will identify and dispel some common myths and misconceptions that supervisors often have about substance abuse, and you will see photographs of commonly and not so commonly abused drugs. We will explore how to intervene with a troubled employee whose performance may be affected by a substance abuse problem. And you will learn how to avoid enabling, the primary means by which employees with alcohol and drug problems get worse. Follow the guidelines established by your organization and its drug-free workplace policy and procedures. If you have questions about material presented in this program, be sure to ask for clarification from your Employee Assistance Program, Alcohol and Drug Control Officer, Human Resource Manager, or other resource person assigned to address substance abuse problems in your organization. Enjoy the program. Addiction is a very treatable illness, and success rates for patients referred from the workplace are consistently higher than for any other group, but follow-up is key. Employees usually enter treatment with proper constructive confrontation that can easily be learned by supervisors and managers. The key is to focus on performance and making the employee responsible for change. Workplace symptoms may not appear for 15 years or more, although symptoms at home may be ongoing. Good success rates in treating employees referred by employers is directly associated with the influence and leverage afforded by the employment setting, which helps the addict feel a strong sense of urgency necessary to complete treatment. Drugs of abuse include alcohol, depressants, amphetamines and stimulants, narcotics and designer drugs, hallucinogens, and inhalants. The cost of workplace drug and alcohol use is believed to be over $100 to $120 billion, according to the National Institute on Alcohol Abuse and Alcoholism. 70% of the average workforce drinks beverage alcohol. This is a conservative estimate. 10% of these drinkers will acquire alcoholism at some point in their lives. This chart shows how tolerance to alcohol works. High tolerance means that a person can drink more than most people and not feel alcohol's effects, even though they are more intoxicated than they feel. On the left, a typical driver may feel intoxicated when his or her blood alcohol level rises to 0.08 and will demonstrate erratic driving. However, a person on the right with drug tolerance to alcohol may not feel intoxicated, and erratic driving may not be observable until his or her blood alcohol level rises much higher. Likewise, more serious problems with alcohol's effects on the body will affect the alcoholic and the non-alcoholic drinker differently. On the left side of the chart are the corresponding behaviors of a non-alcoholic person as their blood level rises. Notice at some point death will occur, but it is below the point of the person who is alcoholic. By the way, the highest blood alcohol level in an alcoholic who lived, found in the medical literature, is 1.5% blood alcohol level, nearly 20 times legal intoxication. Loss of control is a hallmark of addiction and addictive disease. The emphasis is on the word consistently, because anyone can stop drinking whenever they want to. It's staying stopped that separates the social drinker from the alcoholic or addict. Loss of control means the inability to consistently choose when one is going to drink, where or what occasion will drink, and how much will be consumed, and very importantly, what will happen if one drinks. Social drinkers can consistently predict their ability to control all the factors shown here, such as time, place, and amount of alcohol they consume. As the disease progresses, most alcoholics will eventually discover maintenance drinking. This is consuming alcohol at a rate and frequency to stay continually intoxicated. This is why some alcoholics drink in the morning. An employee who consistently has alcohol on their breath in the morning is maintenance drinking to prevent withdrawal. Alcohol or drug addicts with job problems who are in denial about their addiction are often convinced that other problems cause their job performance shortcomings. Such employees are able to convince the supervisor that these other problems are primary. Here is a good understanding of how denial works. Addicts have a definition of addiction that excludes them. Addicts focus on symptoms of addiction that they do not have and use this information to avoid self-diagnosis. Addicts change their definition over time to exclude worsening symptoms. Denial is a defense mechanism that works hand in hand with myths and misconceptions about addiction. Denial is used to avoid awareness and is reinforced by others who are willing to participate in it. Depressants. Depressants are also called downers, sedatives, hypnotic drugs, minor tranquilizers, and anti-anxiety medications. They are grouped into two classes, barbiturates and benzodiazepines. Barbiturates are the more dangerous of the two, especially when mixed with alcohol. Both classes of drugs have alcohol-like effects depending on the dose. Absenteeism, reduced productivity, and increased accidents are associated with abuse of these drugs. Their impact on psychomotor skills is severe and makes them especially hazardous. Depressants produce feelings of euphoria, relaxed inhibitions, disorientation, and reduced motor coordination. Cannabis. Cannabis is marijuana, and its byproducts are hashish and hashish oil. Cannabis is usually smoked but can be eaten. Overdose of the drug will produce fatigue, paranoia, and possible psychosis. Withdrawal symptoms include insomnia, anxiety, hyperactivity, and decreased appetite. Workplace dangers include driving or occupational accidents, accidents from distorted time and space relationships, and impaired coordination. Other hazards include impaired motor skills and concentration. Cannabis is the second most used drug in the U.S. after alcohol. It is grown clandestinely nationwide. When smoked, the user feels high within minutes, peaking out in 10 to 30 minutes. Effects depend on the user's psychological state and THC strength. Low doses provide a feeling of well-being, relaxation, and a more vivid sense of sight, smell, taste, and hearing. Stronger doses may intensify reactions, shifting sensory imagery, rapidly fluctuating emotions, flights of fragmentary thoughts with disturbed associations, altered sense of self-identity, paranoia, illusion of heightened insight, and hallucinations. Frequently reported are hunger and an increased desire for sweet. LSD. LSD is the most potent and most studied hallucinogenic drug. It was synthesized in 1938. The effects last 10 to 12 hours. LSD causes hallucinations and gross sensory disturbances. LSD is a liquid that can be placed on any paper and eaten. Flashbacks from this drug may last weeks or even months, and the most dangerous symptom is impaired judgment. Signs and symptoms? Employees with alcohol or drug problems are troubled employees. Troubled employees are most easily identified by ongoing job performance problems. The key to effectively managing troubled employees with alcoholism or drug addiction problems, or any personal problem, is to focus only on job performance issues like absenteeism, behavior, or quality of work. Avoiding discussions about whether an employee has a drug or alcohol problem and avoiding the need to decide what kind of personal problems exist, if any, results in more alcoholic and drug-addicted employees being referred. A professional counselor completes the assessment. Do not diagnose. Do not discuss an employee's drinking or drug problem. You are no match for the employee's ability to argue against the diagnosis. Your personal influence will not motivate an employee to accept proper treatment. Discussing an employee's possible drinking or drug problem invites discussion about what to do about it. Such discussions lead the supervisor to accept the employee's plan for getting help. Employees with alcoholism or drug addiction problems may seek help from time to time, but it is frequently the wrong type of help, misdirected, not professionally monitored, or just improper. Employees will always seek help that least interferes with continued drinking. Searching for a doctor who prescribes cross-addictive, cross-tolerant medications are a good example. All lead to the same result, a continuation of the drinking or drug problem.